Hello, and thank you for your attention as I discuss with you information related to Westside Community Schools' Universal Screening for Behavior. For some of you, this will be the first time you or your school will be conducting a systemic student behavioral screener. For others of you, this will be a review and a time for you to refresh your understanding of the screening process. I would like to start by thanking the District PBiS Steering Committee, who, through careful thought, research, and consideration, collaborated to identify the selected screening tool, implementation windows, administration method, and contents of this training. During this brief presentation, you will receive information on the purpose, rationale, and the benefits of a universal screener for behavior. You will also learn about your role with regard to the administration process, timeline, and screening windows, as well as actions that may occur as follow-up once results have been totaled. As Connecticut Governor Daniel P. Malloy stated in his charge to the Sandy Hook Advisory Commission, it's a sad fact that shootings like this are becoming all too common occurrences in our country. It's also a fact that in almost every one of these cases there were warning signs. That's why we need to come up with ways that we, as friends, as family, as a society, or a school system, can better respond to those warning signs and hopefully reduce the stigma of mental illness. From bullying to interpersonal violence, substance abuse, parental loss, and grief, many of our students and their families live under persistent and pervasive stress that interferes with learning and complicates the educational process. So what is a universal screening for behavior? Universal screening is the systematic assessment of all children within a given class, grade, school building, or school district on academic, or in this case, social-emotional indicators that we, the school personnel, have agreed are important. It is a process that helps identify students who are at risk for behavioral or social-emotional problems and allows staff to respond to these students with additional support, thus preventing problems from escalating over time. It is worth noting that while screening provides a risk calculation, additional data will be required prior to or during decision-making, as screening is not an in-depth assessment or diagnostic evaluation. Why is it important that educators participate in the universal screening process? Universal screening for behavior using an evidence-based instrument like the Student Risk Screening Scale, or SRSS for short, allows teams of educators to serve in an informed, preventative role. It arms educators with information about a student's social-emotional strengths and needs and allows us to track these over time. We know that childhood and adolescence are critical, formative times for our learners. The earlier we can detect concerns or begin to investigate red flags, the more successful both the student and the intervention stand to be. It seems obvious to most that there are clear benefits to screening our student population, but let's discuss some additional reasons. Analyzing our school-wide or classroom-wide behavioral screening data is more effective than simply relying solely on teacher judgment or disciplinary referral information. Using these data will help to identify those individual students who would benefit from further observations, conversations, investigations, or support. In addition, analyzing data on a larger scale, say by classroom, grade level, or building, will help to evaluate the effectiveness of our PBiS implementation efforts. As all educators know, it is much easier to identify those students who present with non-compliant, acting out, or what we call externalizing behaviors. Yet there is equal and potentially greater benefit in being able to identify those students who present with internalizing behaviors. Research confirms that those internalizing depressive disorders are consistently the most prevalent disorders among adolescent suicide victims. And all teachers have seen firsthand the impact that untreated emotional problems can have on student learning. As you can see from the 2015 final report of the Sandy Hook Advisory Commission, the district is operating in accordance with best practice recommendations regarding the role of screening in school-based health services. So how does this process occur? Let's discuss the administration procedures and implementation timeline. Screening will be conducted 3 times each year on every student and will occur within a window of time during the fall, winter, and spring. It is important that teachers have the opportunity to get to know their students prior to completing the screening, so the dates for this year are October 3rd through the 10th, February 13th through the 20th, and May 1st through the 5th. Each level, elementary, middle, and high school, have their own administration method and format. As you can tell by this table, the elementary staff will be logging into and conducting their screenings in Illuminate, whereas the middle and high school will be utilizing Excel spreadsheets to collect the information. It is our plan that eventually all screeners will be conducted in Illuminate at all levels. Similar to in years past, elementary teachers will be independently screening their classrooms, middle school teachers will be rating all students on their team, and high school teachers will be given a selected number of students from their sections to screen. Here is a snapshot of our screening tool, the Student Risk Screening Scale, or SRSS. As you can see, student names will be listed down the left-hand side, and teachers will rate across or horizontally, indicating a 0, 1, 2, or 3 in each column for each item. Conditional formatting is used to flag scores that warrant educator follow-up. So what do educators need to think about as we move forward? It is important that you are prepared to conduct the screening. Work with your PBiS chair or building administrator to determine the specifics, but in general, you will want to ensure that you have the list of students you are responsible for screening. In addition, you will be more comfortable if you familiarize yourself with the screening tool. It is worth noting, though, student scores are intended to be based off your gut level reaction, based on your own interpretation or understanding of the risk factors. It is not necessary or even permitted to operationally define each risk factor prior to rating. Having these things in place will mean that you are ready to conduct the screening. Once the items are summed for each student, the student's total score will fall into one of 3 categories: low, moderate, or high risk. A score of moderate or high risk does not necessarily dictate a specific follow-up action or intervention. What a yellow or red flag does is prompt teams to have further dialogue, ask questions, and obtain more information in support of the student. Each building will determine how to proceed or respond to students who fall into the moderate or high risk category. There are a number of appropriate action steps along the continuum, from simply conducting observations all the way up to creating an individualized intervention plan, any of which can be implemented based on a student's total score. In addition, aggregated or building-wide scores should be used by your PLCs or PBiS teams to evaluate the Tier 1 implementation efforts in your building. In closing, we know that 1 in 5 students who experience academic problems have some sort of mental, physical, behavioral, or emotional problem. Identifying and attending to those problems as best we can will result in higher achievement scores, fewer disciplinary problems, and happier students, which is certainly a goal of all educators district-wide. Thank you so much for your attention to this presentation and your upcoming participation in our K-12 behavioral screening process. The time you devote to this process will make a difference to the overall health and well-being of our students. If you have questions about this presentation or the process, please contact your building principal, dean, or PBiS chair for additional information.